Hello, friends. My name is Iris Josephina. I'm your host, and you are listening to the Planting Seeds podcast. On the Planting Seeds podcast, we explore how we can cultivate a more gentle relationship with our cyclical bodies, the earth, each other, and the world around us through using our senses, science, the subtle, and the secret. On Planting Seeds, we talk about all those topics you've always wanted to talk about. We are shamelessly opening up the conversations that we all so desperately need to settle in our precious bodies and relate to each other in a more open, truthful, and empowered way. I'm so glad you're here today. This episode really absolutely blew my mind. This conversation with Dr. Miranda Myles is about sperm health and sperm quality and fertility. And we are talking about what is going on with sperm quality, sperm health, male fertility, and the scary statistics that have been coming out since the 70s and that don't seem to be really talked about, even though it has been considered a public health crisis. So I really encourage you to listen to the entire episode, especially if you're trying to conceive, because this information is crucial, is essential, especially for people in their preconception phase. And I'll be talking with Dr. Miranda Myles, who is better known as the Conception Queen and also an all-around women's health expert. She helps women feel better in their bodies and bring their babies home sooner, from menarche through motherhood to menopause, creating healthy periods, pregnancies, and parents. She is a clinical naturopath and acupuncturist, transforming health and hormones, creating fertility in families with a new approach to conception. She's considered a thought leader in women's health, hormones and fertility, naturopathic gynecology and reproduction, IVF and DE-IVF support, male factor, fertility and infertility, and she's successfully worked with over 20,000 patients over 20 years. And her mantra is test, don't guess. She's really obsessed with pathology, and she's very known for her ability to accurately understand and easily explain blood test results to help everyone know their bodies better and become all they can be naturally. Miranda is also the founding director of Freya Health, Hormones and Fertility Clinic, host of her podcast, The Donor Project, an author, and she has several projects on the way, including the Fertile You diet book, Your Evidence-Based 3-Month Diet to Bring Your Baby Home Sooner, and the Thyroid Project 12 Weeks Course to Heal Your Thyroid. Enjoy listening this episode, and do let us know what you think about it, what you learned about it, and don't forget to rate the podcast. Enjoy listening. Are you thinking about starting or nourishing a career in menstrual cycle health? Then consider joining our 9-month online holistic hormone and cycle coaching certification training. In this training, you get science-backed and evidence-based education, as well as teachings about the somatic aspects of having a menstrual cycle, functional nutrition, hormone testing, and much, much more. We will have incredible live group sessions, and you will get guidance from me. There will also be amazing guest teaching lectures from experts in the field, and at the end, you will receive an official certificate of completion that is globally recognized. As a listener of the Planting Seeds podcast, you receive an additional €100 off when you use the code PODCAST when you sign up. Click on the link in the show notes to learn more. Hey friends, welcome to a new episode of the Planting Seeds podcast. Today I have Miranda Myles with me. Welcome to the show, Miranda.
Thank you, Iris. It's absolutely lovely to be here. Finally, we've been trying to plan this for a while.
Yeah, we do. So we are going to unpack a lot today about sperm health And I am really excited to be talking to you about this topic because I feel in this field of fertility, there is a lot of hyper focus on female fertility.
There is.
Yeah. And I'm curious, how do you feel about that? How do you feel about that we focus so much or seem to focus so much on female fertility? And why do you think we have to focus on male fertility as well?
So it's a really interesting thing, isn't it? Because at the end of the day, what we're trying to create is a super embryo, not a super egg, right? So by focusing only on female fertility, we're only focusing on the egg, which is only 50% of that embryo. So it takes at least two people to make a baby, more if you're using donor eggs or surrogates or any other beautiful way of creating your family. But we want this gorgeous super embryo. So that takes two sets of DNA, one from the egg provider and one from the sperm provider. So to focus only on 50% of that puzzle is not going to get you the outcome that we ideally are looking for. And also, male factor infertility is actually the second most common cause of infertility.
Wow.
So 40 to 50% of all case infertility is due to the male factor. So again, to only look at the female, you're only addressing 50% of the problem. Iris, we also know, and this was one of the other things that I wanted to say, that the health of both parents prior to conception affect not only conception, but the pregnancy, whether there's an early pregnancy loss, but also the health of that child as they develop into an adult. So it's not only about conceiving, it's also about having a successful pregnancy, a live birth, and then a beautiful, healthy baby that develops into a beautiful adult. And it's the health of both the parents that influences that.
Oh, I couldn't agree more with you. And I'm so happy that you are also backing this up with statistics. And, every time I hear like how big the impact is of male factor infertility, I'm actually shocked every time.
And it's getting worse. Statistically, we used to sort of go 40% a female thing, 30 to 40% a male thing, and about 20% combined. Well, now it's much, much more even, that 40 to 50% with males. It also makes me a little bit sad when couples then, or intending parents, doesn't have to be a couple, but when intending parents jump into IVF really, really quickly without the male firstly being looked at appropriately, or the sperm provider being appropriately looked at, or they're jumping into IVF when it is a male fertility issue, and then IVF is treating the female or the egg provider for what is essentially a male issue.
Isn't that so crazy?
It's crazy, because once you go to IVF, there's pretty much nothing for the male. There's nothing for the male to do. It's all the female that has to do the drugs and the appointments and the this and the that and the scans and the actual IVF itself. And if the fertility issue is a male issue, then that is really super unfair. IVF is not a walk in the park, and to treat the wrong person for the issue is pretty much the only form of medicine where we do that.
It's really crazy to me. Even when you break this open to the entire spectrum of, what the female body has to go through when it comes to fertility, it's really weird that we put that burden on phenotypical female bodies so often.
Yeah, and it's also, an egg only survives between 12 to 24 hours.
Yes.
So women can actually only conceive once a month, max.
Yep.
Right? But men can conceive or can impregnate a female every single day of their life.
Yeah.
So it's kind of like the fertility focus needs to shift a little bit more to the male if there's an issue.
Exactly. I couldn't agree more with you. And I really hope that the people listening to this podcast will start thinking about this too.
Yes, the sperm provider or the male really does need to be closely looked at and properly looked at.
So if we just plainly look at statistics, I mean, you and I both know that male fertility has declined massively over the last, let's say, 40 years. Could you speak to that a little bit so that people understand?
Yeah. So our grandfather's fertility was better than what our son's fertility will be.
Oof.
Yeah. Men are basically half as fertile as they used to be. And male fertility has substantially and alarmingly, some might say, declined over those last 40 to 50 years, with calls that have prompted it to be a global health crisis. That's not my words, that's research. That's what the researchers are saying. So there's a wonderful study that was done that looked at extrapolated data from 185 different studies that examined semen from 45,000 healthy men, okay? And what they found was that sperm concentration, so that's the amount of sperm per mil of semen, that sperm concentration has dropped from an acceptable 99 million sperm per mil of semen in 1973 to 47 million per mil in 2011. So that's half. So it's dropped from 93 million to 47 million between 1973 and 2011.
Wow.
Okay, so that's half. But that's not all the researchers found. They also found that the average sperm concentration, so that again, that's sperm per mil of ejaculate, in Australia, New Zealand, North America, and Europe dropped by 1.4% every year between 1973 and 2011. So that's a total decline of 52.4%. And then the total sperm count, which is the amount of sperm per total ejaculate, that dropped by 1.6% in that same period. So a total of 59.3%. So what that basically means is that men are producing less sperm, plus they're producing less semen with less sperm in it. Okay, because there's a difference between the total concentration and the total sperm count. Concentration is sperm per mil of ejaculate, and the count is sperm per total ejaculate. So either way, it's alarming statistics. Now, that research was up until 2011. They have since, the same researchers, so this is a guy called Levine, and it also includes Dr. Shana Swan. Recently, so published in November 2022, there was a follow-up analysis by the same team of researchers, and they've found that it's even more alarming in terms of the global health trend. The total sperm count has continued to decline, but at an accelerated rate. So initially, it was dropping from 1.6% every year. It's now 2.64% every year since 2000. So it's gone from 1.6% decline between 1973 and 2011. The updated research says it's now 2.6% since 2000.
Holy cow.
So we're still seeing this decline, but it's at an even more accelerated rate. And that's where the authors have described it as a major public health concern.
Yeah. And we're not talking about it.
Well, not a lot. And I mean, you know of Shana's book. So
I do, yeah.
Dr. Shana Swan in her book Countdown talks a lot about this. And she actually predicts that sperm counts will continue to decline to an average 40 million sperm per mil between basically 2011 and sometime in the not too distant future. Right. So if it drops to 40 million is, so remember it's on average, it's at 47 million now. If it drops to 40 million, male fertility bottoms out at 40 million, right? And conception becomes really, really difficult. And we know that. So it's a really frightening statistic that it's gone from 99 down to 47. If we hit 40 million, it's a really serious problem. Really frightening is that the conventional reference ranges for semen analysis in 2023 is that we're basically happy if the sperm concentration, so not the total sperm count, but the sperm concentration is 15 million sperm per mil.
15?
15.
1.5?
1.5.
What?
And yet we know that male fertility bottoms out at 40 million.
Oh, wow.
So when my patients come to me and show me a semen analysis and their sperm concentration or their sperm count is sitting there at 16 million and they're going, woohoo, you know, I'm over the reference range, which is only 15 million. I'm still sitting here going, yeah, but once we get to 40 million, it's bottomed out.
Oh, wow.
Remembering that where we really want it is 99 million, give or take.
Yes.
So it really is, quite frightening, quite alarming.
It is. And also, I'm thinking, like, where is this going?
Mm.
If all men in the world are going to hit 40 million, it's going to be very hard
That's right.
to eventually sustain the human race.
Well, that's why they're calling it a global health crisis.
Yeah.
So it's a couple of other researchers that have said this is in a crisis. So that decline in semen quality and male reproductive health has been described as being in a crisis. I try really hard not to be alarmist about it because it's like, okay, this is where it's at. We need to be proactive and do what we can to get on top of this and figure it out, basically. Right. And one of the things that Shana Swan actually does say, and we've known this for a very long time, one of the things the researchers say is that it's a lot to do with endocrine disrupting chemicals that are interfering with male fertility. So the phthalates and the BPAs that are disrupting testosterone levels and estrogen levels.
Yeah.
Yeah, so looking at all those chemicals and plastics and, even shopping receipts, they all contain endocrine disrupting chemicals that interfere with the entire hormonal balance. And we've known that for a long time, a very long time. And that's one of the first things that I want the males to start looking at is, the shampoos and conditioners and body washes and aftershaves and anything they put on their body and anything that smells. What is in it? The fragrances, they all are endocrine disrupting chemicals as well. Yeah.
And, I also feel that there is not so much education and knowledge about, if a male wants to look at their fertility. I don't think many males know, like, what can be tested, what can be analyzed, what do we look at?
No.
So when we look at semen analysis, like, what parameters should we be looking at?
Okay.
For example.
Yeah. So I've talked about that sperm count / concentration versus total sperm count. So the sperm count or concentration is the amount of sperm per 1 ml of ejaculate, whereas the total sperm count is the number of sperm per total ejaculate. So normally we want a male to be ejaculating at least 2 ml of semen or ejaculate. Okay, we do want to look at both of those parameters. And that's what I was saying before, that the sperm count has dropped, but so too has the ejaculate.
Yeah.
Which is not great. So we definitely want to be looking at the sperm concentration and the total sperm count. Then we want to be looking at morphology. Now, morphology is looking at the sperm in terms of how normal they are in their structure. So we want one head, one tail, one neck piece. We don't want, a misshapen head or a small head or a large head or no head. Some sperm have no head at all. Some sperm will have one tail, two tails, three tails, or the tail will be too long or it curls in the wrong place. So the morphology is how normal the sperm look. Now, what's interesting about that is that morphology has also changed enormously. So
yeah, I read about that.
Yeah. So the World Health Organization has the reference ranges, and those reference ranges have changed over time. Now, again, I just want to segue for just a moment. When we're looking at those normal reference ranges, it's looking at from 1980 to 1987, 1992, 1999, and then 2010. Now, we do have to give credit to, or we do have to look at the reference ranges may have changed just purely due to technology, advances in technology, and being able to accurately measure sperm. So we do kind of have to go, the reference ranges may have changed independent of a sperm health or a male fertility decline, right? So we do have to take that on board, that technologies have changed. But the facts still remain that in 1980, we wanted the morphology in a percentage, so the number of normal sperm, to be 80%, right? 80.5 in actual fact.
Per ejaculate?
So that was percentage of the total sperm,
Okay.
right? We wanted 80.5% to be normal. By 1987, that had dropped to about 50%. 1992, that had dropped to about 30%. So by 1992, we were saying 30% normal morphology is the benchmark now. In 1999, that went to 14%. And then in 2010, that now sits at 4%.
So 96% of sperm can be like quote unquote abnormal? Is that what that means?
That's right. And that's considered the benchmark. Now, again, we have to look at this really logically and go, okay, well, maybe we realized that we didn't need such a high percentage of normal sperm to achieve conception or from a fertility perspective, right? And technologies have changed. But I still look at that and go, it can't just be down to technology, that level of change. Not when we look at the fact that the count has dropped so much. This morphology must have changed to some degree based around male fertility as well.
Mm-hmm.
Does that make sense?
Yeah. And then also when we have to base that on like how technology has shifted and changed, to me, and I'm assuming also to you, fertility is about much more than just reproductive health. It's about
Absolutely.
overall health of the entire body ecosystem.
That's exactly right. That's exactly right. And that's what's really interesting with the semen analysis as well. This is just one part of the puzzle for male fertility. You can still have the most beautiful semen analysis, like really great, but there can still be other things that are affecting the health of the individual that can interfere with fertility, because our fertility is an extension of our overall health anyway.
Yeah. It's funny to me how sometimes like male fertility is like reduced to this testicle, this thing that just exists on its own.
Yes.
While for female bodies there is like knowledge about like, okay, the brain like communicates with these ovaries, with these gonads, but for the male body it's the same.
That's right.
The male brain communicates with the male gonads, and everything that's in between the brain and the testicles is impacted.
Absolutely.
Males also have hormone receptors all over their bodies.
That's exactly right. And so those hormones are being used everywhere and impacts the body all over. And then there's also, we know that what both the egg provider and sperm provider, or the male and the female, eat prior to conception also changes the quality of the sperm.
Yeah, and I think what you're speaking to right now is an important thing, because I feel a lot of people, when it comes to quote unquote infertility or subclinical infertility, people feel very powerless.
Yes.
But there's actually a lot of things that we can do for ourselves and support ourselves with to support our bodies and our fertility. Could you speak a little bit more to that?
Yes, absolutely. So one of the things, so I've sort of already touched on the EDCs, the endocrine disrupting chemicals, and that's a real thing. Women, when we look at a female, a woman can put 164 different chemicals on her body every day just from doing her normal routine of getting herself showered, moisturized, hair done, makeup done, perfume.
Wow.
Right?
Yeah.
So males, I don't know what the actual number is for males, but they use aftershaves and they use all the laundry detergents, cleaning agents, and everything in your home that is a conventional cleaning product or laundry detergent or bench wipe. They all have endocrine disrupting chemicals, that specifically the phthalates and BPAs, that affect sperm levels and affect testosterone levels. And then the phthalates specifically mimic estrogen. The phthalates suppress androgens, so that's testosterone. So males and sperm providers with high levels of phthalates in their blood have been shown to produce low testosterone, fewer sperm, or damaged sperm. The phthalates have actually been described as gender bending,
Yes.
meaning that they cause males of many species to become less male. And the phthalates interfere with the development of the male reproductive system, leading to genital defects and things like undescended testes. But even if it hasn't had that level of physical reproductive damage, it's the functional reproductive damage, the function of suppressing that testosterone, which of course is going to affect sperm levels.
Yeah.
The other thing is that we have a single healthy sperm requires 15 different nutrients for its quality and its structure. So what you put in your mouth, how you fuel your body every day, influences what your sperm get.
And I'm assuming these nutrients are similar to what is needed to nourish female fertility.
So different parts of the sperm need different nutrients. So the head, for example, and the head is where the DNA is. We actually haven't spoken about the DNA fragmentation, but in the head of the sperm is where the DNA is. And the only job of that sperm is to pass that DNA onto the egg to create an embryo. That's all it has to do, deliver the DNA to the egg so that we can create an embryo. So we want that DNA to be amazing. It's very normal to have a little bit of broken DNA. So, and that can be age, wear and tear, just a little bit of broken or fragmented DNA, really, really normal. But the nutrients that we need for that DNA quality to prevent fragmentation include vitamins A, C, E, D, folate, and B12, plus zinc and selenium, plus the antioxidants coenzyme Q10, alpha lipoic acid, and lycopene, plus L-arginine, so arginine.
Yeah.
And that's just for the DNA fragmentation.
Many people don't know this.
No, that's right. And funnily, the DNA fragmentation, so when we look at a semen analysis, the DNA fragmentation is not part of your standard semen analysis testing. DNA fragmentation has to be requested separately. And that makes no sense in my brain. I just cannot get my head around why we are not checking that as part of a standard semen analysis. Standard semen analysis is count, so that the count or concentration, the total sperm count, morphology, motility, progressive motility. We need to be testing the DNA fragmentation, because if the DNA is fragmented, it can still fertilize an egg, so we can still get an embryo. However, the research shows that dodgy DNA fragmentation is implicated in early pregnancy loss.
Wow.
And see, this is one of the things that kind of drives me a bit crazy as well, is that we used to always think, oh, well, if the sperm is able to fertilize the egg, then it's a super sperm and we don't need to worry about it. And then if there's early pregnancy loss, I don't like the word miscarriage because nobody intentionally miscarries their baby. So I prefer to use early pregnancy loss. But when there is an early pregnancy loss, it seems to always be put down to it being something to do with the egg or the female, which couldn't be further from the truth. So if the DNA is fragmented anywhere between 0 to 15%, that's considered excellent. 15 to 20% is good. 20 to 25% is fair. And if it's over 25%, then that's considered really poor quality DNA. And you've got a good 6 to 12 months of work to do with high levels of antioxidants to fix that up.
Have those ranges also changed, by the way? The ranges that we use for DNA fragmentation?
Not that I'm aware of.
Okay.
Because DNA fragmentation is not part of standard testing. So I would have to check that for you, Iris. I don't know about that.
Okay.
And it is one of those things, if the DNA is fragmented, it is fixable. You can fix it. You just have to get to the root cause as to why it is so fragmented. And again, that can come down to EDCs, or it can come down to poor nutrition or some sort of trauma. So physical trauma, a varicocele or some other physical trauma to the testes themselves. It's really important that that is looked at. in my opinion, for all men to really be delving into what's going on with that DNA, because also the DNA can affect the embryo and stop the embryo from continuing to divide. You know, you may make a day 3 embryo, but it may not get to a blastocyst stage, or even if it does, the DNA can then affect the pregnancy.
So actually, when we look at it in that way, when we would incorporate DNA fragmentation in standard testing, we could actually like almost prevent the intensity of pregnancy loss if that was looked at.
Yes, we can help prevent one of the potential causes for early pregnancy loss. I don't ever like to blame anybody for why there is an early pregnancy loss, because it's often a combination of lots of different things.
Yeah.
But this is one of those modifiable risk factors. And so why wouldn't you? You know, why wouldn't you modify it if you can? And you can. That's the thing. It's not the end of the road. I've had, patients with DNA fragmentation at 45%, which is very, very high. And we've done a lot of work with antioxidants and successfully got that DNA fragmentation down. It does take, time. You're looking at sort of between 6 and 12 months to get that DNA fragmentation better, and then go on and have a successful pregnancy. It's always multifactorial early pregnancy loss. There's always lots of different things going on. And this is just one of those things that really has to be looked at in that process.
And like if people, let's say, have difficulty to conceive, is there a way for people to make sure that when they start, semen analysis and semen testing, that you can ask for a test like that? Is it a test that is done within the medical system, or do you have to go outside of the medical system for that?
No, it's done within the medical system. So you get it done through an andrology lab. So any of the IVF clinics that have proper andrology labs. And that's actually one other thing that I would really emphasize is the importance of getting a semen analysis done by a proper andrology lab. This is what they do every day, not just a standard, blood testing place. Going to a proper certified andrology lab and getting your specialist. I mean, I can get it ordered for patients here. We can do it here. You don't have to go outside the normal medical fraternity to get it done, though. It should actually just be standard.
I totally agree with you. What a big topic to unpack this is. And, I also feel that there is so much people don't know and so much insecurity around this. And it's actually a very vulnerable, sensitive topic. And my wish is that we can open this conversation and that also men amongst one another can start talking about this.
Absolutely. Absolutely. I think it's always been in the past that if there's a fertility issue, then, you're not a man or there's a problem. It's just people haven't been talking about this, and it's really, really important, because otherwise all the responsibility again falls to the female or the egg provider, and that's not fair either. There's more than just the female in this.
I couldn't agree more. And also, I feel the sperm providers also deserve support.
Absolutely.
With what they're struggling with.
Yes.
They deserve community. They deserve care.
That's right. I remember one of my patients, so it was a couple that came, and he was coming to the appointment to support her. And once I sort of started talking to them about it, he just sort of opened up and really went, you know what, Miranda, I have been ignored every single step of the way here. No one's asked me any questions about my health, or no one's done any semen analysis or checked what's going on for me. And I said, well, that's really sad and really unfortunate. And he said, so what can we do? What can we do to check me? And it was like, this is why you're here. So there are those men or the sperm providers who want that. They want the support. They don't want it to all be on their partner. They want to be stepping up and being involved and part of the process, because again, it takes at least two to tango with this.
Yeah.
Single person can't do this without both pieces of the pie.
I completely agree with you.
Mm.
And to close off, are there any things that you think people should really know, or any wise words you can share with people who are potentially struggling with this?
So I think one of the other things that I would say is that there was a study that was done in 2018, one in 2016, one in 2018, that looked at, the use of alcohol and smoking, marijuana and cocaine and all of the drugs that can affect sperm quality. But there are also standard pharmaceutical medications that can reduce sperm production and quality as well. So I'll give you an example. A patient of mine came to me and they were, for other reasons, looking at using donor eggs. So, of course, when that's the situation, the focus is very much on the male, the sperm provider. And so I said, right, let's get a semen analysis done, see what's going on. He'd had a semen analysis done 2 years prior, and his count was brilliant. It was at 320 million, which was just amazing, great numbers. And that was 2 years prior. Then we got this more recent semen analysis done, and his count had dropped to 0.
What?
0. None. No sperm.
How did that happen?
So we went through this whole process, and the lab actually called him back in to do a second test because they just wanted to make sure it wasn't a testing issue. But what we found, once I started to ask some questions, I said to him, there has to be a reason why your sperm have just all dropped. And he was actually taking anabolic steroids, and they are male contraception.
Oh my God.
So it was a testosterone-based anabolic steroid. And as soon as he stopped taking that, it takes about 3 months for it to sort of rectify itself. And within 3 months, his levels had come back up again. But luckily we checked because they were about to go to Spain to conceive using an egg donor. Well, they would have got to Spain and there was no sperm. So I think sometimes it's not always understood some of those things that can reduce sperm production. So antibiotics can, antipsychotics, anti-inflammatories, opiates, antidepressants, anabolic steroids, testosterone drugs, methadone. There's all sorts of different pharmaceutical medications that can also interfere with sperm health. So I think that's a really, really important one to sort of remember as well. Yeah, but it is all fixable. That's the big thing. Or usually it's fixable.
I think the beauty of the male body is also that they're continuously producing sperm.
That's right.
So they have so many opportunities to support their bodies. Like it's slightly different for our bodies.
That's right.
But I think this is the beautiful thing about the male body ecosystem. Like they're constantly creating new sperm.
Exactly.
Basically every day is an opportunity to support.
That's right. And it takes 74 days for kind of the life cycle of a sperm. So that's where it's usually around 3 months. Same with females, we look at that 3-month preconception care. Males, it's around 74 days to regenerate sperm. And you're right, Iris, every day is a new opportunity for them, whereas for the females, it's not quite that easy. The other thing I will say that I will leave you with is, and this is to all males, please keep them cool. The best thing you can do for your little swimmers is keep them cool. So remembering that the testes hang on the outside of the body because sperm do not like heat. And one of the things that we know is beneficial is to ice them. And it's for 10 to 15 minutes, 3 times a day, either sitting on a bag of covered peas, like actually, so the testes are resting on them, doing that 10 to 15 minutes, 10 to 15 minutes, 3 times a day. And it gets the Leydig cells moving and it stimulates everything to get moving and it combats the damaging effects of heat on the sperm. And you can actually buy jocks now that have little self-contained ice bags in them.
Oh, really?
So that would be my number one word of wisdom, is to keep them cool, ice your balls.
What a beautiful note to end on. But in essence, we won't be ending here because we actually also have another episode that we're going to record on female fertility.
We do.
About which I'm also really excited.
Yes.
So if people want to find you, Miranda,
yes,
what is the best way to reach out to you?
So they can find me on socials at Dr. Miranda Myles, MIRANDAMYLES. So that's both on Facebook and Instagram. Or they can find me at my clinic, which is at freyahealth.clinic. And Freya is FREYJA. So a couple of different places. Or find me on my website, www.mirandamyles.com.au.
Amazing. I will make sure to paste those in the show notes as well. And I want to really thank you for making the time and coming on here to share all of your knowledge and wisdom and bring us into the research and shed some light on this very important topic.
It's an absolute pleasure, Iris. It's lovely to chat with you.
Thank you so much for listening. If you enjoyed this episode and you'd like to help support the podcast, please share it with others, with your friends, with your family, post about it on social media, or leave a rating or a review on all the platforms. To catch all the latest news from me, you can follow at the Planting Seeds podcast on Instagram or at Cycle Seeds on Instagram, or you can go to my website www.cycleseeds.com. Thank you again so much, and I'll see you next time.